I want to get this in one take.
You should hear me do the voicemail, like the voicemail gradings.
Yeah?
I do those like 10 times.
Hi, this is Dr. Patrick S., and I'm a Maximize Living Wellness doctor here in Charlotte, North Carolina. Today we're going to cover the first part in maximizing your health potential. We're going to talk about the first essential to health, which is called maximizing your mind or maximized mind. So in order to kick off this one, we need to first identify exactly what is health. How do we define health? So if you wake up in the morning and you're going in the bathroom and you look at yourself in the mirror and you ask yourself, am I healthy or am I not healthy? What would you use to kind of quantify for that or qualify that? So a lot of people would say, well, I look like I'm healthy, right? So they say maybe I'm thin or I'm skinny or I look fit. So they might say that the way I look dictates my health. Some people might say, I have no symptoms, right? So I'm not coughing or sneezing. I don't have heartburn. I don't have digestive issues. So they might say because I don't have any symptoms that I'm healthy. Another person might say, well, I exercise all of the time, right? So maybe they're training for like a triathlon, or they just like to work out, and they say because I exercise all the time that I'm healthy. You know, another person might say, well, I don't smoke, I don't drink alcohol. So again, because of that, they're saying, well, because I don't do those, because I don't participate in those events, then I must be healthy. Another person might say, you know, I don't take any medications. So no medications. And because they don't take any medications for anything, then they would consider themselves to be healthy. But if we look at all of these different reasons, you know, could you find someone that looks healthy, that looks skinny, that looks like they're fit, and could that person still be unhealthy? The answer to that is yes, right? Because you could look great, but you could still be developing, say, high blood pressure. Because when do you feel high blood pressure come on? Or you could be developing cancer. When do you feel the effects of cancer coming on in your body? Not, unfortunately, until it's too late, right? So you can't look at the way that you look to determine whether or not you're healthy or not. Same thing with exercise. It wasn't that long ago that we saw someone who was participating in a triathlon who came out of the beach, was running down the ocean, or running down the beach rather, came out of the ocean, was running down the beach to start his running event, and he had collapsed from a heart attack right there on the beach. So here you would have taken a look at a guy who was in his mid-30s saying, man, he's in great shape, he's training for triathlons, but he had a heart attack right on the beach like that. So again, we can't look at our fitness level to determine whether or not we're healthy. And then same thing with smoking and alcohol. You know, can you smoke and still be healthy? That might be a difficult question to answer right now, but yeah, the answer to that, of course, is yes. We know people who smoke who never develop, say, for example, lung cancer, right? So we can't look at whether or not we smoke or drink alcohol to determine whether or not we're healthy. And then the same thing with symptoms. We kind of talked about this a little bit already, but just because you don't have any symptoms does not mean you're healthy, because how long does it take before you feel the symptoms of cancer, or before you feel the symptoms of diabetes, or before you feel the symptoms of high blood pressure, right? So you can't look at symptoms to determine whether or not you're healthy. And then the last thing is true also for medications. Just because you're not taking a medication right now does not mean, again, that your body is functioning at 100% capacity. So let's identify actually the word health. What does it mean then to be healthy? Well, if you Google the word health and Google the word definition, the World Health Organization back in 1948 defined the word health as being when your physical body, your emotional body, and your spiritual body are all working in harmony. So it's not merely the absence of sickness and disease, it's when all of these, you know, your physical, your emotional, and your spiritual well-being are all working in harmony at 100%. And if we look at the word health even, the first 4 letters of the word health says to heal. So really, a healthy body is a body that's healing at 100%. That's how you know whether or not you're actually healthy or not. So now you might wake up, you might look in the mirror and you might ask yourself, well, how do I know if my body's functioning at 100%? If I can't base it on how I feel and how I look and whether or not I take medications or I smoke or not, how do I know if my body's functioning at 100%? Well, let's take a look at this for a minute. If I draw a line graph and I put 0% down here, if your body's functioning at 0%, where would you be? What would that mean? So 0% would equal death, right? If 100% equals health and healing, and 0% equals death, let's put some stats on this graph. What if I say that you're functioning at 20%? So if your body's functioning at 20%, are you healthy or unhealthy? Yeah, you'd be unhealthy, right? What if your body's functioning, say, at 60%? Would you be healthy or unhealthy? You'd still be unhealthy, wouldn't you? You'd be better than 20%, of course, but even at 60%, you're not at that 100% capacity, so you'd still be considered unhealthy. What if your body's functioning then at 90%? Well, at 90% you're doing really well, right? But you're still actually unhealthy because you've not achieved that 100% function. So even at 90%, your body's still unhealthy. So how do you know where you would fall on this scale? Well, ask yourself a few questions. Number one, do you have any symptoms? Because if you have things like headaches, if you get digestive issues, if you're fatigued, if you have anxiety or depression, or you have high blood pressure or heart disease, or if you have acid reflux or Crohn's, or if you have sciatica, knee pain or neck pain or migraines or anything like that, if you have a symptom of any kind, then what that means currently is that your body is functioning at 60% or less right now. What we know through research is that if you lose 40% function of your body, that's when you first begin to feel symptoms. So if you're sitting there watching this video and you say, yeah, you know what, I have one of these symptoms, I have a headache, or I get back pain, or I have high blood pressure or something, then right now your body's functioning at 60% or less. And that's a scary situation. So how then can you reverse that? How do you take that function and get it back towards 100%? Well, then you need to know what it is that controls the health and the healing in your body. What is it that makes your body function harmoniously? What is it that makes your heart beat and your lungs breathe? And what makes your digestive system function and your reproductive system function? You have to take a look at that. And what that is, that's actually your nervous system. So what we're going to cover in the very next webinar series is we're going to talk about how to maximize your nerve system. What exactly does your nerve system do for you to maintain health and healing? And how do we turn that system on to maximize its potential? So until I see you on the next webinar, have a healthy afternoon.